I'm on the phone if you want to. Well, glad you guys are here. My name is Carol Lee Way. I have the privilege of being the interim president and CEO of the Amarillo Area Foundation. We're here today to discuss on how broadband access is how we are right now in rural Texas, and particularly the Texas Panhandle, and maybe talk about some exciting things coming and where we all hope to be together. This is an issue that really touches every part of our life. It touches how we work, how we learn, how we access healthcare. And it's going to take our entire community to tackle a problem this large. So I'm so excited to see people here from our rural communities and people from our ISPs and from our co-ops and people doing digital navigators and healthcare. This is what it's going to take, is this entire community to say, this is where we are, but this is where we want to go. I'm really excited to have our guests here, Molly and Heather from Connected Nation. And then we also have our guest, I lost your name. Carla from, she'll remain a mystery till the end. We have a surprise. But this is going to be a really good conversation where Molly can talk to us about what's going on with Connected Nation and in the state in general, and then we'll drill down what's going on specifically in the Panhandle. And I'm also really excited to hear from our panelists because I know we have some interesting and innovative things happening right here in the Panhandle. And I know the rest of the state gets surprised when they hear what Texas Panhandle is doing, and we love that when we are the cutting edge of a lot of innovation right now. So without further ado, I will have Molly come up and give us a little overview, and we'll invite the panel up to finish the discussion. Thank you all for being here.
Thank you, Carolee. Like Carolee said, my name is Molly Weiner. I am from Connected Nation. We are a national nonprofit that has just focused on broadband and all things broadband for over 20 years. We have been working in communities, mostly rural communities, for decades, really on how do you close the digital divide. So this is an issue that is near to our hearts as well, and we have really loved our collaborations with the Panhandle, with the Amarillo Area Foundation, and some of the work that we've gotten to do. And so, quick agenda, I want to get to the panel. The panel is going to be the exciting part of today, right? We're going to hear healthcare, agriculture, what's happening in digital inclusion, but I do want to start with kind of a little bit of kind of broadband basics and kind of jump into some state and federal broadband updates to kind of provide that context. There's a lot going on. If you follow broadband news, it feels like something new is happening every week in the state. A lot of changes going on. So I want to just kind of do a quick couple minutes there, and then we'll jump into that panel. So like I said, we're Connected Nation. We've been working on this on broadband for a really long time, including in the state of Texas. So we kind of first got involved in the Panhandle, working in Wheeler County and some other places in Castro, Donley, Hall counties on some technology action plans. And so what we really do is we come in and we bring together a group of community stakeholders. We talk to healthcare folks and ag folks and public safety and schools, because like Kelly said, broadband touches everything. We know that. And so we want to build kind of some comprehensive solutions for the communities. That work has included a lot of broadband mapping and field delegation work. If you look at a broadband map, you know that they are good, but can always be better. And so we have done a lot of work in that space to really kind of drill down, especially in rural places where connectivity is and isn't. Our work is also included, and we'll touch on kind of some of the state updates, supporting the Broadband Development Office during the planning phases of their BEAD program. We've worked with them on their initial proposal on the Texas Digital Opportunity Plan and some of their other planning documents as they get ready for their big challenge of connecting the entire state. And the last thing I'll highlight is just we do a lot of kind of digital skills and digital opportunity training as well. So it's over 1,000 Texans in the state. We bring basic digital skills training. We do kind of some team leadership and leveraging almost digital navigators to kind of help serve their community, because we know that connectivity is more than just infrastructure. It's devices, it's skills, it's being able to actually use that connectivity for all the things that you want to do. So I will hop. Do you want me to pause? Okay, we'll come back. I saw a picture going up on the slide in the back. I just want to quickly, I think that most of us can speak to parts for all of this graphic, but to really drive home the point that high-speed internet creates economic opportunity, and it creates it across a wide variety of sectors and folks. So you can look at what it means to be doing connected farming and what increases you can see there. for small business owners having access to the internet and being able to promote their services or sell their products outside of kind of their general area. Think of healthcare and access to telemedicine, what it means for just residents being able to work in places that they want to work in, work remotely, have opportunities to jobs outside of their geography. So we know that having that high-speed connectivity, having that connection is really important. And this graphic configuration one is also in the Connected Nation folder, so you'll see it there as well, having that data. Given that connection, knowing how important it is, there is a divide in the state. There are challenges that the state is facing. And so kind of some key data points across, you'll often hear folks talk about access, adoption, and use as kind of the key pillars of connectivity. When you look at who's unconnected in our state, according to kind of the federal maps and the BEAD program, it's about 245,000 homes across the state that are either unserved, no connection at all, or underserved, they have a connection that's not very fast, doesn't meet the definition of broadband. When we look at affordability, there are a lot of folks who maybe there's a physical connection to their home, but they can't afford the service, or the service is really, really expensive. And when the broadband office did some survey work in the last couple of years, they found 40% of rural residents pay over $100 a month for service. We've seen other studies coming out of Deep East Texas in places where service is 3 to 4 times higher in rural areas than it is in urban areas of the state. And so affordability is really kind of a key component of this digital divide in terms of who's getting and staying connected. And then on the adoption and use side, once you have your connection, what do you get to do with it, right? We see that 77% of rural residents were saying their service wasn't adequate. They wanted either more options, faster service, different things like that, to do a bunch of things. So like 4.5 million Texans use telehealth for the first time during the pandemic, right? People want those telehealth opportunities, those, their remote health devices that are connected all the time, all the different opportunities that come to monitor and improve health outcomes. And then only the latest USDA report, only 13% of Texas farms report using precision ag practices. And a lot of that's due to connectivity challenges. So we're going to dive kind of into healthcare and ag side. So I won't jump into that too much, but we know that there's missed opportunities here. And then not to like be the AI boogeyman, but the access to AI and its emergence is a real new facet of the digital divide. And one I think we're all just starting to kind of wrap our arms around, that we know that there are going to be additional opportunities, and the folks that aren't connected are going to fall further and further behind as these new technologies roll out. And so quickly, we're going to talk a little bit about federal broadband programs. So I just want to kind of level set on what is broadband. You can get it from a bunch of different technologies, right? There's a bunch of ways to get an internet connection. One way is mobile broadband. So device, you have a connection on the go, it moves with you place to place. So that's one connection. You've got kind of your cable, your DSL, fiber, that's a physical connection into your home, right? Whether it's from a cable television provider using their networks and infrastructures, whether it's fiber optic cables, DSL, those are another way to get connected. We have fixed wireless, so those are customers can receive an internet connection, right, with some type of receiver in their home, and they're getting a signal beamed in from a tower that's nearby. And then similarly, satellite, you have some type of receiver and you're receiving that signal from a satellite. The important thing about all these technologies is that the state of Texas and the federal government have said, you have a high-speed internet connection, you have a broadband connection if, and they've defined it. So no matter what technology you have, you need a speed of at least 100 megabits per second download and 20 megabits per second upload to be considered high-speed internet or broadband. So that's a really important definition when we talk about grant programs. And when you look up your maps or you go find your house and you see if you're getting red or green on the map, right? That speed is really what determines that determination. Do you have 100 by 20 connection with less than 100 milliseconds of latency? So kind of that's travel time. So when you think about that, if you get internet from any of these connections, they have to meet that speed threshold to be considered served. I've shown this picture for a really long time in a lot of conversations. I've done it here in Amarillo before. I've done it across the state. And we always have big conversations around it, and lately all CN gets is like, hold on, what's that satellite up in the corner? I'm hearing a lot about satellite, what's going on? So I want to dive into it for just 1 minute, kind of just talk a little bit about satellite, what it means, and then what it's going to mean for the federal grant programs, because there's been some important changes in the past few weeks to how satellite fits into that picture. And so just to kind of level set on this, you'll see up here the two main kinds of satellites that are providing internet connection today. You'll see the GEO satellites, that's kind of your traditional satellite. So if you think that's been around 20 plus years, you may have subscribed to satellite service at some point or know someone who has. In a lot of the rural communities we've been in for a long time, it was the only connection in town for a really long time, was getting satellite service. And it came from a GEO satellite provider. And as you can see, the satellites are really high. They're 35,000 plus kilometers above the Earth, and they're pretty large, so they cover large ranges. And so what that means is that the signal goes all the way up and comes all the way down. And so traditionally, those services were slower, they had more interference in them because of that distance traveled. More recently, we've seen the emergence of low Earth orbit satellites, or LEO satellites. And these are smaller satellites. They get launched in little groups or constellations, and they get launched at less than 2,000 kilometers above the Earth's surface. So you can see they're closer to the Earth. They are getting some faster speeds and response times because of that shorter distance. And the important thing for the federal grant programs is that GEO satellites typically have not met that 100 by 20 threshold. If they weren't considered providing broadband service, so if that was your only option at your house is often marked unserved or underserved, right? It's eligible for these grant programs. We're seeing with LEO satellites on a house-by-house basis that they can get to those speeds of over 100 by 20, which is important when we start talking about these federal grant programs. They also, because there are more of them that get launched up in the constellations, there's more resiliency in the network, because if one satellite goes down, there are others nearby to provide that signal. There's a chart kind of the comparison. I won't walk through it all, but I will just highlight one of the reasons it's become such a hot topic is not only the federal grant programs, but just some of the emerging applications. So we are seeing LEO satellite get used in places where it's really expensive or difficult to build. So if you've only got 2 or 3 folks in a square mile, it costs a lot of money to build infrastructure. Also costs a lot of money to build infrastructure through certain geographies. And these are the realities that state and federal broadband programs and providers are contending with when they think about where they're building. And so LEO emerges an opportunity there. And it also has some applications across industries, agriculture, the defense sector, right? You think emergency response communications, providing redundancy for folks. So there are some opportunities that people have been using LEO with. I say all that to say, Texas is looking at all these technologies to figure out how do we get everybody online. And so they've got a couple of big grant programs that I want to highlight here, where they are considering different ways, different technologies to bring connection to the region and to the state. I'll talk about on the bottom first, the BOOT program. The BOOT program is up and running. They are digging, there are shovels in the ground, it is being built. There are a couple of different projects in the region. The first round of BOOT was about what, 326 houses across 2 counties where internet service providers received funding to build out in those communities. And then in BOOT 2, Carson and Roberts counties were awarded grants also from the broadband office. Again, they were awarded 2 internet service providers to build out connection to all the unserved and underserved homes in that state, according to the state broadband maps. So that's one big program the state's running that's bringing infrastructure. The other one is the BEAD program, the Broadband Equity Access and Deployment Program. Texas is actively in the middle of this right now. They are in a sprint to the finish line on BEAD, but Texas has $3.3 billion to spend to connect every home that's unserved and underserved in the state. It's about like 245,000 homes that are left. And so Texas has been working on this for a long time. They wrote a 5-year action plan. They wrote an initial proposal. They held community meetings. They collected surveys and data. Many of you in this room participated in that extensive planning process to get to the point we're at today. And now they're running the program. And they are due to turn in their final proposal on September 4th. So what I want to highlight is what's happening right now in that program. NTIA made some changes to the program on June 6th. And so one of the biggest changes was that they put a 90-day shot clock on it. So that's where that September 4th date comes. By September 4th, every state in the country, not just Texas, right? Everybody gets to participate in this. We'll have decided on who's getting all of the BEAD money across the country. So that's up to $42 billion that's going to get allocated in these next 5 or 6 weeks to help close the digital divide across the country. So Texas is running their sub-grantee selection right now. Actually, the application window closed last Tuesday. And so they are considering applications. And what they're doing is they're taking a look at all of the applications. One of the main things that the notice did was that it ended kind of the automatic fiber preference. So it redefined a broadband project to anything that can meet the speed threshold, right, of 100 by 20 with under 100 milliseconds of latency. So that definition of broadband, and is scalable, right, and has the reliability pieces with it as well. So they've done some work to say any technology is eligible for this as long as they can meet the requirements and show us that they can provide speeds that the federal government says are broadband and can scale over time to meet evolving needs. As we're going to hear, technology is continuing to grow and advance, and there are evolving needs, right, where we need more speeds, faster speeds, less latency to get to do all of the things that we want to do with technology. And so they updated some scoring guidance as well. So the broadband office is working through all of this right now. And they released some data last week. They got over 4,500 applications for all of the areas of the state. And I believe they got an application for almost every location. So they are going to make some big decisions over the next few weeks that we will eventually see to help drive to close that gap and to build a more connected Texas. What we want to highlight today is this work is happening and the state's going to make its decisions, and there's going to be a lot of infrastructure build and construction happening over the next 2 years. And it's exciting because of all the things we get to do with it. And so that's what I want to focus on today is what are we doing with it now? What could we do with it if we have even more connectivity and skills and devices, and if we're all of those pieces that go along with the infrastructure? I will misquote Heather, but she's always talking about, right, we're not talking about connectivity for its sake, we're talking about people. That's why we care about technology. That's why we care about connectivity. And so we think of all the exciting things that are coming, whether it's advancements in AI, healthcare innovations, and some of the interesting things we can do with telehealth and remote monitoring, precision agriculture, what it means to build a connected farm, and economic development as well. We hear from communities all the time how broadband is one of their core strategies to attract business, but also to attract people that want to live and work in their communities. So we want to touch on all of that today. So what I want to do is I want to call up our panel to have this discussion. And we're going to keep it kind of open and loose. I've got some questions, but we'll take more questions if folks have them as well about anything we've talked about today. But I want to start there and kind of show a little bit about what's happening in the Panhandle. Perfect. I want to kick this off. We've got kind of names and faces up here, but just quickly to run down this line, if you'll just tell us, give us a quick intro, who you are, who you're with, and kind of how connectivity intersects with that. We'll start, Jacob, we'll start with you at the end.
Yeah, my name's Jacob Cates. I came on about 7 months ago as the Digital Initiatives Coordinator at the Range, which is a regional accelerator. I like to think of it as kind of the R&D department of the Panhandle. We seek to address big issues that face the Panhandle through collaboration with educational institutions, nonprofits, businesses and industry, and government. I've also recently taken on some more executive roles as our organization grows and as we have to do more and more work that keeps us more and more busy.
Great, I'm Brian Weiss. I am the regional dean for the Texas Tech University Health Science Center School of Medicine here in Amarillo. As Molly pointed out, really the COVID-19 pandemic really pushed a lot of telehealth forward very quickly. And what we're seeing is that with the technology now, we can reach a lot more people in rural settings. And so that could be both at an individual level in terms of people in their homes, but it could also be regional levels, such as hospitals like BSA or Northwest Texas being able to support regional facilities through these telehealth initiatives. So a lot of real potential in terms of how we can spread the resources of our providers in this community amongst a lot of rural counties in Texas.
Clark, I'm just glad we should do that. I'm a retired healthcare consultant, administrator, primarily worked with at-risk rural communities. And latter part of my career was developing community needs assessment and community health teams. So I thought my time with all this work. And I'm sitting here with really experts.
Except for me. I'm Carolee Clay, as I said earlier. The foundation decided in 2019 to make broadband access and adaptability one of our prime focus areas for our strategic plan. And so from there, I started meeting with a lot of people in this room to start figuring out what that meant. And so we focused more, obviously, the foundation is not out pulling fiber. We're not doing a lot of the infrastructure work, but we're trying to help coordinate some of that with our communities. But we really leaned into device, how we can get devices in people's hands, and also how can we train people to be ready for the jobs that are coming now, and more importantly, the jobs that are coming at us very fast for our students. It's a changing world for them and what the jobs are going to be in our future. So those have been our focus areas on in this front.
Howdy, I'm Matt Garner. I'm the founding executive director of the Range. And just to kind of reinforce what we do and kind of how this all comes about, right? So the Range is a regional accelerator, and what we do is we work with education, we work with industry, work with NGOs, work with government to really try to get projects, big projects done here that really promote our area's citizens and what they do, right? So it's about productivity in people, just like you said. And really our 5 areas that we're working on are water, workforce development, rural healthcare, emissions, and digital equity. And so you can imagine, how can we measure how much water we do or don't have without a device that measures that, right? How do we deliver education across a huge area without being connected? And then, how do we get these autonomous tractors to drive themselves and spray less pesticides and things like that when we're not connected to these big databases that help us get those efficiencies? And so we can't get better, we can't be more efficient, we can't preserve our resources if we're not connected to the internet.
Awesome. All right, we will dive right in. And Carolee, I want to kick this off to you. Just given your perspective as a regional funder, as someone who's got these projects across the Panhandle, can you just describe kind of what connectivity looks like? What's the state of it across the region? Are there parts that are more or less connected? Kind of what are you noticing in terms of as it relates to broadband connectivity?
I would say our more frontier rural communities are still very underserved. I think we need more providers in the area to help drive down costs. I know that doesn't make some of my friends out there happy to hear, but that is just reality. And I think we also, it's very hard when you're talking, I know Matt's gone through this, when you're talking to rural communities about what they need, we have to be careful because we're making assumptions of what they need. So a lot of this is really going in and asking them, what is it that would make life easier for you all without completely disrupting the way you already live? And I think that's been something we've seen too, is every community is going to use internet differently based on what they need. They're going to have different access needs. They're going to have different digital learning needs. But I think more than anything, it is we don't know what they don't have yet. So there's a lot of questions that we need to do, a lot of listening tours we need to have and understand. But there is still a tremendous need. We saw it with our fires last year that really highlighted to us the lack of equity in our connectivity in our rural communities. Whereas people in Amarillo can very easily take for granted that we have 4 different providers to choose from. And when we go down, we have redundancies, whereas it takes one backhoe to hit a line in communities and they're out for hours, if not days. So that can't be the norm anymore. So it's still a lot of work that needs to be done, but I think we feel optimistic that we have a lot of people coming to the table that really want to work to bridge this divide.
Right, and now I'm gonna throw it kind of to the, both from the agriculture and the healthcare perspective, and Jacob, I'll start with you, kind of, we know having that connection unlocks opportunities, and we're gonna hit on some of them, but so talk to me first about some of the connectivity challenges that you're seeing kind of as it relates to the agriculture space, or kind of any of the work the range is really doing around connectivity.
One of the things that is interesting when you hear people talk about BEAD and other types of funding formats is that they talk primarily about households served. And there aren't that many households, so they start to look at the division of costs, per head, and they go, well, that's very unseemly, it's very expensive, and the turn might be to rely on cheaper, faster deployable technologies like LEOs, but they're not going to have the bandwidth that a fiber connection would, or even a reliable nearby fixed wireless connection might. One of our arguments, one of our hypotheses is that rather than counting, just households, when we think about a connected panhandle, we should be thinking about all of the businesses and applications that exist within rural areas that really do harbor our economic engine. So, if the panhandle is the nation's dairy shed at 10% of the nation's dairy production, if we're our beef shed at 40% of the nation's beef production, if we produce $35 billion worth of agricultural goods and in the allied sectors annually, then what we should be doing is thinking through how do we connect dairy farms, how do we connect feedlots, how do we connect farms that are growing forage and silage, and making sure that we are providing them bandwidth to do those things that Matt was talking about earlier, to better, more efficiently use the resources that we have, especially when we have an endangered water table, to consider IoT or Internet of Things solutions to wildfire detection, to help utilize existing technologies that would need to rely on heavy broadband access that increase efficiencies within, say, the dairy space or the feedlot space by helping us better feed cows or better milk cows, or a better turn, those food producers into dollars per input. And so what we really think we should be doing is considering how do we connect those businesses, how do we connect those farms, how do we make sure that there is a stable, broad infrastructure for those industries, and then how do you connect the rural hospitals that serve those communities? How do you connect the businesses in small towns that serve those communities, the school districts, those anchor institutions, which play a big part in what goes on? And so we're working on a couple of projects right now. One has been graciously funded by our friends at Amarillo Area Foundation to look at IoT sensors deployed in the field to track water and other nutrients within the soil, as well as sensors that could be deployed in the field that would help us with particulate detection, early detection of wildfires, to help protect some of the investment that we've made in the area. We're also looking at some projects that have salience in the ag space, particularly helping connect really future farm type industries to better internet and to better broadband and to better internal Wi-Fi, so that the productivity on those types of farms is able to surge and go up, and then protect those jobs, protect the small family farms from a changing climate, and also get them more bang for their buck when it comes to inputs.
I'm going to follow up on some of the things I think is really important. And you heard me beat this drum, Molly, for years now, but the maps are built on households. And so you look at a map of the Texas Panhandle and you think this is a household out in the middle of nowhere that needs Netflix, and it's not. It's a business that needs connectivity to be able to keep up with what's happening in the world. So it's not someone needing to watch Netflix. It is a business who needs high-speed, reliable internet to be able to function in their industry. So that's been our frustration up here the whole time is we're measuring households. To Jacob's point, we're not measuring what a business is. And I think that would be a truer measurement for us in our rural communities.
That makes sense. I think we were joking before the start, right? If you counted every cow and every person, you start getting a much richer population
Every
density.
spigot on the internet,
Right?
yes.
All of these need connectivity, absolutely.
A lot more cows than people up here. So,
And they're all important.
I just don't know. We're paying taxes directly related.
Dr. Wentz, Brian, from your perspective, kind of similarly, what kind of challenges are you seeing related to connectivity for folks either trying to access healthcare or for kind of the healthcare innovation work that you'd like to see happen?
So I've been in this community for over 20 years now. And when I was a younger doctor, I used to have patients come from these regional areas to my clinic. And it was a big day for them. And they come into the big city, they go shopping, they eat, and that's great as long as you're reasonably good health, you're mobile, you have a working vehicle, and all these things that then become obstacles to people being able to come to the physician. Right? And so what we're seeing now is this need, especially now we're also facing significant provider shortages, is the need to go to these folks where they live. And so you mentioned something I think that's is technology like remote patient monitoring. What this is there's some really novel technology now where we can actually monitor people in their homes. So someone who has congestive heart failure, I now have the ability to monitor the fluid content of their lungs, okay, or their weight, or basically the angle at which they're sleeping. And hopefully, if I'm seeing signs of worsening heart failure, I can hopefully get to them and intervene before they have to go to the emergency room or be admitted to the hospital. Again, this is all technology that does require these rapid connections and be able to build a network where I can get that data to me in an efficient way and I can monitor these patients. So that's been a big part of it. And then certainly if you talk about these regional facilities, things like teletrauma, so the TQHSC trauma service has set up some preliminary efforts to say, okay, if a trauma patient goes to a small regional facility, can we help optimize their care at that facility before they have to be transported to Amarillo, to BSA or Northwest? All in the hope that patient will do better, what we call the golden hour, which is that 1 hour after trauma. If we get to those facilities and help those providers to optimize their care, it's better for the patient. All of this needs these connections we talked about in terms of broadband.
Can I ask a little bit? So I don't know if any of you did this, but I made the poorly informed decision to drive to Oklahoma the day we had that giant windstorm here in the Panhandle in March. I want to say like March 15th or so. And I kept thinking the entire way, if my grandfather, who is suffering from Parkinson's, who has had to receive palliative care, if he didn't live in Amarillo, if he still lived in a small community like Channing, where he lived for a long time, would he be able to get the care that he needs in a timely manner? Especially when that high wind is kicking up or when there's distance that he has to drive and he's starting to suffer those kind of effects of Parkinson's that really do start to get life-threatening. And I kept thinking, no, I don't know that he would be able to in the current situation. And so for me, and I think for those of us with aging parents or grandparents, that access to rural care is so personal. And I don't know how many people in the Panhandle are suffering from Parkinson's simply because they've been exposed to Roundup and all those other things that they've been working with over all these years. And so when I hear, TTUHC talk about these sorts of things, or Dave talk about these sorts of things, this is near and dear to my heart when I think about my family who's been in the Panhandle for years and is starting to hit that age of decline in so many ways.
Jacob, you brought up something earlier I thought was a great point. But the president of our university talks about the fact that if you look at mortality rates and zip codes, you will see a connection between life expectancies and certain zip codes. And there's significant reductions based on some zip codes. That's a shame. There's no reason why your zip code should determine how long you live and how well you live. And again, because it brings up the need for these connections to be able to get to these areas where people up to this point have not had good access.
Dave, would be curious kind of from your perspective, challenges, and I guess, and I'm even thinking kind of on, if you can speak to it, maybe not the patient side too, of being able to have that connection, right? Have a device where you can speak back and forth to your doctor, like those types of of skills too being really important to this, but kind of curious, Dave, from your perspective on the challenges.
Yeah, I think I'm just supposed to be the Baptist that says amen. Actually, I'm Presbyterian, so they don't say amen, I'm gonna kind of go another way. I happen to have done clinics in hospitals in multiple counties years ago, and I knew it was the best we could do. And you get that da-da, and you find a connection. Pretty frustrating, when you're in a hospital and you cannot connect technology in any way, much less communicate with patients. So hats off to the 4 counties you're working with. And those are tough ones. I think besides all of this, we're talking about technology and speed, is there's huge reimbursement problems. And so physicians are a big issue here. State line licensures are big issues here. And so when it comes down to a lot of the doctors, they're not going to buy the equipment to do it. I think the university and medical centers have done the best job. My wife, because of Parkinson's, is at UT Southwestern, and on the Epic My chart, which is a system here at Baptist, her whole telemedicine is on the chart. So when she goes on lines to check in, which might be visits or medicine, and she's due for a telemedicine conference, it's there. So we're not having to figure out how to get on a computer and get networked, and now you're sitting and holding for the meeting and all that kind of stuff. People get really frustrated with that. I came from a non-technology world, so I threw a lot of computers out the bedroom window, and calling my wife saying how to get out of this program. So that's not uncommon for most of the people we're talking about. So I think when we talk about all this neat stuff, doctors are not getting paid well enough. They're not willing to invest the capital in. And so then there's license issue from state to state, not so much with university systems. And so I'm in the biggest group I'm enrolled with who I go to see a doctor. No telemedicine. And they did during COVID. Everybody got hot and bothered about that, and they got some money. Well, it was there before COVID, okay? The technology was there. And then COVID came and passed, and it was like, it all went away. And so it became an issue, whereas, you're gonna get paid for this? Well, you're gonna get paid $32 because the reimbursement went down 2% this year. Not a lot of money, but for a lot of doctors, it's like, I can't keep taking these hits. I tell doctors I ran practices all over Texas, and it's like, just give me your nurse practitioner and give me a warning and let her sit in this room and let her do telemedicine. Different from telehealth, okay? So when we talk telehealth and telemedicine, telemedicine is more on the clinical side than telehealth. We use the terms interchangeably, but they're very different. So most of us that we're talking about up here are telemedicine. Psychiatry, by the way, is the #1 use of the telemedicine. And so Texas Tech's got 2 great programs, all online hotspots with psychiatric, pediatric, and postpartum. And those are probably the best things that ever happened in Texas, especially the Texas Panhandle, and having access to psychiatry. I was in Hereford, Texas, some time ago, and I was walking through the ER, and they grabbed me and said, "Hey, come in here and kind of keep this guy occupied." And he was not on his meds. So I said, okay. So I walked in there, and I'm on 3 mental health boards in the Panhandle. And so, different languages, different words I learned. I can't use the word crazy anymore. It's like, yeah, we got the guy in room 3 over here that's just crazy and crap. It's like, so I belong to a mental health board, and I have to pay a quarter every time I use the word crazy. I have to go to the bank every time we board meeting. It's the ward I came from. It's like, oh, we got some real mental health problems. So I'm sitting there, and we roll a TV in there, and we're going to hook it up to, telemedicine with a psychiatrist. And he's from Texas. It was from TPC, Texas Panhandle Centers, and it was their program in Hereford. So anyway, he looks at me and says, excuse the language, "What the hell is that for?" And I looked at him. I said, "Well, we're going to hook you. We're going to let you talk to that TV." And he kind of looked at me and said, "So who's crazy, you or you?" And it's like, wow, I didn't really think about it. I said, "I'm going to talk to that TV, and that TV's going to talk back to me." And it's like, yeah, you pretty well got it. It changed my whole idea about, wow, we've got some real issues about doing that. So as we talk about high-tech, fiber, not fiber, satellites, if you really come down to the low level, we've got physician practices aren't using it. We've got rural healthcare clinics that are still not using it, and they should be on top of it. We have federally qualified health centers that are still not using it. Those that do and really get it, really see the impact of being able to get on, line and talk to somebody. Psychiatrist will be example, has got huge problem with psychiatry. There's just good luck even getting to a psychiatrist's office. So psychiatric perspectives should be coming in. I'm putting a behavioral health complex together on the border. And the number one thing people ask us is, I can't get to MRO, I can't see a doctor. My primary care doctor throws antidepressants at me. And, I don't feel good, and it's worse. And most primary care doctors will tell you, if you go to the bathroom and close the door, they'll tell you that, this whole mental health thing's got me perplexed. And so, I think we don't think about radiology. Radiology is number one when it comes to telemedicine. So telemedicine, radiology, and psychiatry. Primary care, which we all care about, is down the line. Okay. So reimbursement, licensure, cross-country, cross-county lines from New Mexico. I mean, just talking to somebody down. But a lot of us have just kind of gone past all that. We don't worry about it, thankfully. So reimbursement's a big deal. Compliance is a big deal. Doctors willing to say, I need that in my practice.
Dave brings up a good point, and just even bringing that down to a lower level is we can give them all the technology and the broadband and the access, but if we don't teach them how to use it and meet them where they are, it's all for naught. So I'll call out my friend Maggie over here. Maggie's been working on our digital navigator program here through the libraries, and we're going to be launching it out. But one of the things that she's done that's so brilliant is she's starting with senior citizens. So she's been working at the Axe Community Center, and she's not just putting them online and saying, hey, this is how you do Word. This, that's not relevant to them. She sits down and she's worked out a curriculum that is relevant to senior citizens and what they need right now. And I think that's something that could be helpful in working with doctors, right? Because we did that with some of our primary care doctors doing mental health screenings, and they gave them the technology and the coding and to be able to bill for it. And we're seeing a big difference already. So a lot of that is, it's really important that we understand that access and portability is two legs of the three-legged stool. If we don't really teach people how to use it safely, this is a very big important part too, and effectively, then all of this conversation about speeds and Leo and all of that is for nothing. So we have to make sure we're doing that all at the same time. But I hadn't thought about needing it for more of our professional.
Yeah, no, good point. 4 years ago or so, in another life, for senior citizens, we bought iPads. We got different companies in town that buy an iPad because we found people that came in senior citizens wanted to talk grandchildren. So we, checked out iPads to them and taught them just how to do Facebook because they just want to talk to grandkids. And they go any further, some were like, hey, come on, bring it on. This is totally cool. So the very population we're trying to take care of, especially in rural clinics, is Medicare, Medicaid. They can't afford an iPhone, maybe a flip phone, good luck on that one. They don't have computers, and so there's a real technology problem with a huge part of our population that could benefit from this. So a lot of communities are sending out, much like doctors who have scribes that help them, do all the dictation, is we're sending community health workers out on certain schedules to help people, navigate. I've got a doctor's appointment with my whatever, at 4 o'clock, and I don't know, I don't have anything to use. So we're taking the technology out to their home. Well, that's well and good, but you just open up a whole fire of the need out there that you just simply can't serve. So I was real proud of her for this. Like, you're getting iPads and you're going to go out there and teach old Joe, how to get on Facebook. And it's like, he's going to keep your, what out. So good point made though about, my life's been out in rural communities, and I've learned I never say I'm from Amarillo because I'm in trouble right there. And I better go back with a different car next time so they don't recognize me, because in saying that, there's a huge mistrust between us meaning Amarillo, and those that are out into the rural communities, the language is different, the demographics are different, communication is different. How you walk in and what clothes you wear is even a big issue with all of that. So we have a lot to learn going out and connecting with those rural communities than being the big animal foundation that's been coming in and saving lives. And
No, I think you guys hit on, I mean,
Think Kristen.
relevance. Oh, yeah, go ahead. No, jump in.
When we talk about providing shortages, how's that, I mean, how's that play into the telehealth, I mean, with the local communities calling the animal doctors that they're used to, when there is a shortage, you know, even just in Amarillo, we're seeing it in local communities with this shortage of doctors, they just think they're gonna do it in their back class, you know, for Walmart, and they're gone. So, and I'm just kind of curious, when y'all say shortages, we also understand one thing, local communities, there are shortages, how's that going into this?
But there are two, I mean, in Amarillo here, we have significant shortage. We are unable to recruit certain disciplines of providers to this community, which is a real challenge. So what we have done is we are using teleneurology at the hospital, telestroke, right? So that's allowed us to bring in these services, that are not really available here for our hospitals here. And we hope to do the same thing for some of these regional areas, because, a lot of times in these old emergency rooms, you may have a mid-level provider, nurse practitioner, or physician assistant, and they may have limited experience in certain areas. And so I think if they knew that they can have the easy button to lean into some of the expertise at the hospitals here, that's just reassuring in terms of them feeling they can give the care to those patients they need to right at that moment.
That one more question. How are those conversations happening now with Amarillo? Like you just said, it's hard Amarillo rural. How are those conversations being to be had?
Well,
no, they go for
Well, I should say, just one thing we've done is about 8 years ago, we started what's called the Accountable Care Organization, the Northwest. And this is what they call an alternative payment model for Medicare. This ACO has been really great in terms of most of these regional facilities are in our ACO. And it has allowed us to have these conversations as part of a kind of a united network to say, how can we support each other? So that's been the thing, is just, I think as Dave was saying, is you get to know each other, you start speaking the same language, and then ultimately say, how can we support each other what we're doing?
So, one of the boards I'm on, it's called Aspire Mindful Place, is 501c3. We put together a board where we bought a Presbyterian church. And for $2,000, I mean, a Baptist might have been more, but we got to get great help. Lock, stock, and barrel. If you need a cross or a communion table or something, and an organ. Here's what we found. So we're putting in a psychiatric nurse practitioner from West Texas State. If anybody could get a crown on their head at the WT, putting them in a psychiatric nurse practitioner program, because you get psychiatrists, LPCs, blah, blah, blah. But the biggest thing we've got from 6 primary care doctors in Warner, Hutchinson County, is so glad you're putting in a psychiatric nurse practitioner and telehealth, because this is over our head with mental health. And so the problem that we don't like to talk about, who are you going to call in? Who are you going to connect with telehealth? Because there's so many doctors in Amarillo that might be what I'm going to call your top echelon of doctors who are really, these guys go to, besides that, don't have telemedicine. And so you got a real problem in trying to get people, and I think that's where the universities fit in, is that's where university medical centers fit in, have those clinics, have those services and whatnot. Texas is really a young medical school. And you look at other medical schools, across the state, problems are not as great. They're there. But for me to sit in Border, Texas and say, my doctor needs to send me to this doctor, I need to be on telehealth in Amarillo, I usually say on the way home, good luck. Not a good answer. I mean, those are some of the questions we don't like to talk, or answers we don't like to talk about in slides. Is that satellite, I don't care, internet, whatever's fine, whatever brand you're calling that, that's all great. Brad hit it. Businesses are a huge problem. So to connect homeowners out there, we've got businesses that don't even know how to do internet. And so, I think when it really comes down to, we've got to get to the grassroots. We've got to get more doctors saying, I can make some money on this. It's not going to be the panacea. I can use my nurse practitioner or just my good nurse that can get back there and handle 90% of questions, which are usually pharmacy and got a headache and my kid's sick and his ears hurt, you know, that can be handled on telemedicine and not come into a doctor's office. I have an appointment Friday, okay? I no more need to go in that office and fly into the night. Okay, and I know the business is like, I don't need to be there. What I could do with the telemedicine and I'm done. Replace my gabapentin, you know, whatever it is, that needs to be renewal. I'm on a 3-month Medicare visit. This is easy. Now I'm gonna get up and I'm gonna go clear over to the medical center and wade through a parking lot that's 5 acres big and get into a building, get to the 3rd floor and wait with 30 other people. That's crazy. Excuse me, 25 cents. So, you know, all of that could be telemedicine. So I think, you know, Dr. Weiss gets this, but you sit a room full of doctors in here and take a poll, how many do telemedicine in here? You would see few hands go up.
All right, I'm gonna transition.
What is the difference between telemedicine and
Telemedicine is going to be dealing with clinical issues. Telehealth is going to be more, ear infection, easy stuff. I don't have to see you, I don't have to touch you, you know, things like that. Home health, you know, things like that. So, you know, there's a great example of an Amarillo doctor who services clients in El Paso, and he does it robotically. So they know when he's going to go online. They fire up the robot. It's got a camera on it. Uses a nurse that does the blood pressures and all that kind of stuff because they can't get doctors to serve their unit. And so it's like, wow, you know. And so he really gets it. Does he make money on it? He only makes money being the medical director of the unit. Not how many times he fires up that robot, you know, and get not a lot of payment, you know, and that. So I just say usually telemedicine is you're sick, clinical medicine. I need to see you, I need to touch you, I need to put a stethoscope on you, I need to look in your ears, I need to have dialogue below, you know, what it might be otherwise.
the fixes needed at the state or federal? Well,
Check, do that again.
the fixes that we need, a licensing, are those need to happen at the state level or the federal level?
With licensing, I mean, it's like I'm a Texas doctor, but I'm licensed in Texas and I'm not in Oklahoma. That's beginning to be an issue.
But just, so the some of the reimbursement though is also at the federal level. So during COVID, there was a lot of liberalization of payment for telemedicine and telehealth. Problem is those are being rolled back now. So and even since September 30th, there's going to be further reductions in reimbursement. So again, of course, if these are kind of working against some of these plans now, in terms of using more of this technology.
So some of them we could, now some of them we can't.
All right, I want to transition us kind of back to the agriculture discussion and, you know, the Department of Ag has done a lot of work. They've been in the broadband space a long time, really supporting rural communities. They talk a lot about connecting the last acre. So, Dr. Gardner, can you talk a little bit about kind of more about what the range is doing, but also kind of what are some of the challenges, maybe similarly to what we're having on the healthcare side, governmental, physical, right, economics, like what are kind of the challenges you're seeing to having more adoption, some of these connected farming practices across the region?
Sure. I mean, I think one of the issues that spans all these things is there is no lack of technological solutions to solve these problems, right? If you wanted to, you know, I've got a blood pressure monitor on my wrist, right? I don't need to go to a doctor to get my blood pressure. I can play what it is, right? My heart rate, things like that. Only costs me $30 a month, right? So that was developed by some whiz bang guys that, you know, probably on the East Coast and West Coast, right? There are applications out there where we can put probes in the ground and we can say, hey, dude, you don't need to water your corn. It's got plenty of water, right? How many people do you see in the last couple of weeks, watering their fescue yards, me included, right? But I've got a battery on my Rainbird, and it says it rained, you don't need to water today, right? I can save water with it. So kind of our issue is that you can do remote patient monitoring. Anybody here can talk to a therapist online, and kind of work out some of their issues. You can buy a tractor that self-drives itself, right? You can buy robots that milk cows, right? There's even a company in Amarillo that has robotic equipment that can bandsaw ribeyes so you don't cut your fingers when you're doing that. Because that was actually one of the number one injuries in the 80s and 90s. People cut their fingers off, cutting ribeyes, ribs, things like that, all kinds of wet meat on Sunday barbecues. So one of the things that the range is trying to address is kind of bring some awareness, first of all, to those technologies, because I think it's exploding, right? How many of us have cool tennis shoes because our wife or best friend had them, or have, this because we saw someone else have it, right? The farmers here are very isolated. They're not being supported by UC Davis or all these interesting things are going on, or Penn State or Cornell University, where you have paid extension agents that are going, hey, you ought to use this technology so you're feeding less minerals to your cattle. So not only will you save money on minerals, but you'll have less minerals entering the environment, which enters the watershed, right? So there are some very scientifically progressive things that are out there. And by the way, they'll save farmers a lot of money. So we have some of the biggest farmers farming some of the biggest sections of acreage in the country, and they're also the least progressive. So that's a real head scratcher. Why is that? Well, it's the same reason our hospitals aren't doing certain things, and it's the same reason our schools aren't doing certain things. The Panhandle, someone who is fifth generation Panhandle, right, went off to the East Coast and did some interesting things and came back. What we all realize living here is that it's not very progressive, right? Let's build this, let's build that. Well, we don't want to pay for it. So it's hard to see what the long-term effects of adopting technology would be when there's an immediate expense, right? The most progressive farmers, by the way, are the ones that are up here, and they have the robots and they have the pivots that turn on, and they're paying $25,000 a mile to run fiber optic cable to their farm. That's about 4% of farmers. So that's why you see, well, 13% adoption rate. So those 4% of the farmers are farming 30% of the land. Okay, so I think what the vision of the range, working with the Amarillo Area Foundation, Texas Tech, and WT, and some of these industry folks, is saying, what do you really need? And so I think several people said part of that process, which we call the stakeholder-led innovation process, is really is asking the farmer, what would you like to see happen different on this farm? Well, the answer will always be, we want to make more money. Okay, okay. Period. I want you to make more money too. So have you thought about investing in this or investing in that? And like, no, that costs money. So in some place culturally that has always functioned on a, I'll pay for it when I have the money, on a kind of a week to week or month to month basis, where other coasts are operating on a finance model. They do things like build bridges and build, we don't have to build a lot of bridges here, we have to build a few, right? But we haven't thought about how long-term financing, investing in infrastructure really goes into our equation. So I'll give you a couple of very quick stories. So we went out to a local regional medical center, and it's pretty sweet. It's one of the best ones in the county and one of the best ones in the state. So like, what are your problems? And they're like, well, our power goes out like some of the time. power goes out. It's like, yeah, turns out they're on the rural electrical grid, and when cotton gin fires up, they don't have any electricity. Well, that's a problem, right? We also went to this dairy, and it's the largest robotic dairy in Texas. So imagine this, they have 4,800 cows. They spent about $48 million building this new robotic dairy. It's awesome. It's amazing. And we took a multi-billion dollar company. They're the biggest company that builds communication devices in the world. And they said, well, what's your problem here? And they said, well, our internet. Well, don't you need the internet to work with your robots? Yeah, but internet's expensive. What do you mean internet's expensive? Well, we're paying $3,000 a month for it, and if they wanted to see a really fast internet, it would be like, you have to pay like $300,000. And you're going, dude, your like daily feed bill is like $80,000. I'm like, yeah. So you're not going to spend like 4 days of feed to connect to the internet? And like, well, no, that's like, it's like $300,000. And so they were able to finance these robots, $48 million. I don't know what the interest payment on that is, but it's a lot of money. But they weren't thinking about that. So we came in and interfaced with them and said, hey, what if basically also a local provider here of internet helps you get internet? And so it was in both cases, right? There's a couple simple solutions. One to the dairy farm is, why don't we just tunnel internet and it'll cost you like $50,000 instead of $300,000? Well, we like that, right? You gonna pay for it? Well, we were hoping you would pay for it at the ranch. Like, well, let's get you on payment for it, right? The other one is the hospital. It's like, well, why don't you get a rectifier, right? And it's like, well, our electrician said we didn't need one. And it's like, he was obviously wrong. And then I talked to Derek and I said, why do you think they did that? And he goes, well, probably because this electrician was probably the same guy that like has installed those irrigation pumps. You know, they don't even know what a rectifier is, right? Any musician who's ever played in a rock band otherwise, right, knows that you need a line conditioner on your amplifier or you're going to get all kinds of feedback. Well, and that's what you need, right? So you need generators, battery banks, and things like that. So I think the thing that's frustrating, but also presents a large opportunity, is that these solutions are hard, right? It's like feeding the world isn't hard. You just have to move the rice and the beef and the peanut butter to a place where it's hungry, right? It's what gets in the way of feeding the world. Like, we make a lot of food, right? What gets in the way of people being able to sign up for cheap internet, right? That's more political than it needs to be. And so I think that the last thing that I'll have to say is that, you know, one of the things that the Panhandle needs to do a great job at doing is saying, we don't care if you live in these big giant cities on the East Coast and you have this beautiful skyline views. Like, we'd like to go there once in a life show. But while you're doing that, all our cows are making that cheese for your pizza, or all our farmers are making that corn for your tortilla chips, or making the corn that goes into your Tito's vodka, or whatever it is, right? I think we shouldn't view ourselves in that we can't tap into the technology that's developed on other coasts, just like people are eating the food that we produce every day. So I really think the bridge that we need to cross is one of changing that mindset and just realizing that everybody does something different, and that's okay. But we need to self-advocate and promote for what we need. And you know, the purpose of this is we need internet. I can buy $48 million worth of robots, but if I'm not willing to spend $3,000 a month to connect to the internet, those robots aren't going to work. You could buy a self-driving car in Amarillo and it's not going to work simply because it can't talk to the cell towers, because one of the cellular providers decided to take the towers, right? So there's lots of stories like that, but in the end, I think what the range is trying to do and get out there and promote is, what are the problems that you have? Are you willing to come up to the table and say, I'm willing to work on this problem as well, right? Because it's like that last mile, right? If Fiber can go all the way across the interstate, but unless somebody can exit from the interstate to the school or the internet to the hospital, it's just fiber that somebody spent $23 billion on and nobody's connected.
Just hearing all of this, I think what's really important for all of us to start talking to our communities about is that mental mind shift that needs to happen here in the Texas Panhandle. Let's be more proactive about our needs. I have a couple of board members in here, so they hear me talk about our need to advocate a lot right now. We have the solutions here. We have the people here, we have the relationships, and that's our secret sauce, right? I can pick up the phone and talk to any of these guys anytime I want to. I have, I can talk to pretty much anyone in the Panhandle, but we've got to have us all come together with a shared vision. And if any of y'all can go back to your communities and share that, that's, I think, where we need to start. Of how do we all start talking from the same language, using the same data, with the same need, going in the same direction, and I think we can make some progress, but I know I can be a little bit of a Pollyanna about that. But I think we can do it, because we have the human connection resources here, and I think that is a part that we can talk about broadband and all of that, but our secret sauce here is that we can get in a room and solve a problem together, and we do it all the time. So I think we can continue to do that in this space.
So here's a good example of reality. That sounds good, right? So 6 years ago, we woke up and said, we've got a big mental health problem in Amarillo and the Texas Panhandle. COVID brought a lot of that to light. And so through Representative Ford Price, it was like, we've got to come together and find a way to quit paying delivery system costs. We're paying a lot of money out there to pay people to do things. But when do we sit at the table and we, as a community, figure out how to do this? So here's a great example. Panhandle Behavioral Health now for 6 years began to sit people at the table. And then we did that in Hereford. We did that in Dumas, and we did that in Border. So Ford Price his big deal was, we need to target rural communities, and we need to come up with models how we deliver mental health services, because we're not doing it very well. And certainly we can't work to the Amarillo or whatever to do that either. It has been phenomenal to be able to go to a room. I'll pick on Dumas. There's the police chief, there's the county judges, the Dalhart guys are over, sheriff, deputies, hospital, nonprofits, sitting in the police station every month in Dumas, Texas, talking about how do we come together and deliver mental health services in the county. It's phenomenal how we decide to sit down and drop all of our stuff and all of our agendas, because I walk in, no matter how long I've been in rural areas, when they find out I'm from Amarillo, it could be Midland, it could be Odessa, I'm almost at a default. So I have to undefault myself to say, I get what you're doing. I've been out here my whole career. So the table is important. I think we're smart enough to sit down and get all the agendas, because why we don't do that very well in Amarillo, and why we're doing so great in the rural areas, they're in desperation. In Amarillo, there are so many games, there are so many agendas going on. We can't sit in the same room and come up with ideas that this is going to work, because I'm trying to get my agenda out before yours, because mine's better. And it's like, wow, how hard is that? And we can go to Hereford, bam, immediate. We can go to Border, and after 6 years, we're building a behavioral health complex. Imagine that. We're going to serve 6 counties. And it's like, and I worked and ran the hospital and put clinics in Hutchinson County and knew the judges. And I'm thinking, you just sent me to hell. Okay? Because that's a difficult county to get everybody at the table, because there's been so many agendas in that town. We just finally, after 5 years, have got the right table, the right people doing the right thing. It just takes time.
So, Holly,
Yes.
in your presentation, at the beginning, you mentioned, Valley County, Hall County, and a couple of others that have already, or planning to implement some sort of, one of these broadband technologies. Is that correct?
So,
And so, what is it, and who's going to be connected? And we can just say they're all in Hall County.
Yeah, those are 4 counties Connect Nation work with. We do kind of the technology planning on the front end. So we built kind of a community broadband team. We did some survey work across sectors, kind of built a roadmap. So it wasn't we're gonna build infrastructure to these 10 houses with this provider at this.
I think it's actually about the food grants.
Yeah.
Oh,
The counties who were awarded the
gotcha. The folks that are awarding me, yes,
Big money to do.
they're gonna build infrastructure to those homes. So
Those went to ISPs too.
it's a mix of fiber and fixed wireless. I can pull it up by county for you. With it.
I'm just kind of curious.
Yeah.
I mean, to the home within the city,
It depends on the program, but in boot 2, it's gonna go to every home that the broadband map, the state says doesn't have internet in the whole county. So it'll be outside.
An ISP here who's not answering the question.
I kind of, okay, so, the state recognized, they pick out positions that are uncertain, underserved, and we're sent a map bill on that stuff. So, ISP is one, based off of what the state recognizes, mostly rural customers, so whether it be farms, farmers, or specific areas. One area I can think of is like Southbridge, or an area just south of County One, just next to no service. Down, things like that. So, they recognize basically these people want that us as people going for the best price possible for get the services based off of the state. So to answer your question, who's going to be service, who the state recognizes as being the need, even the needs of that at the time.
So,
So
you know anything about Donnie Hawkins?
Donnie Paul, now Carson and more.
Okay, can you then speak to Carson? Carson, who can be served?
Carson's gonna get served by Plains Internet. It's fiber connection to 778.
Because I'm a farmer out in Carson County, and I want to have access to internet as a result. He says no.
I mean,
Up to the ISP.
they're required to bring connection to every unserved home and business that was on the broadband map, right? So that's the asterisk in the corner, right? But technically, if there was an unserved business or home in the area.
I think that's a fundamental problem that us agriculturalists have, is they're recognizing homes. And that's one of the things that we're really advocating for, and unfortunately, I think it's gonna come from like a separate chunk. So I can tell you that the range is working really hard with, a local ISP provider and a multi-billion-dollar company to come up with a solution that addresses that. Because the fiber is running through that county. And so then the question is, how could we deploy that? So to answer your question, right, there are solutions that can broadcast really fast internet over a course of multiple miles. And it's pretty agnostic, right? So that's our goal. So I'll give you an illustration. We've talked about it a little bit, but we talked to one farmer and he goes, I'm paying each pivot. I'm basically buying a cell phone connection to that for the course of about $100 a month, right? He runs a lot of pivots. So his monthly cell phone bill is $14,000. Okay. It's a lot of pivots, right? But we could cut that by about a third by using something that's similar to Wi-Fi mesh systems, right? Because each one of those doesn't need its own cell phone, right? You could have a couple that just basically talk and broadcast one up. The same would be true for if we want to deploy, and that's the reason that's one reason that indwelling soil moisture probes have not been developed, because all of them would require a signal. So let's say you have a quarter-mile circle and you want to put 4 moisture probes in that thing. Are you going to spend $400 a month for probes? Probably not, right? Are you going to save that much amount of water? Absolutely, right? And so that's where we really need to promote the similar types of systems that, say, like a hotel has. That's a couple $1,000s a month. You could deploy that kind of system to hundreds of devices on one farm and get all types of useful data. Again, just going around the point is that the things that are recognized are homes. They're not around economic activity at all. They're not around the jobs that are created. So as long as the farm workers have the internet, that's fine, but what about the farm? I can tell you from talking to farmers, this is like, if we could get the internet to the farm, we would broadcast it out for free to all our farm workers. And so, again, I think that's pun maybe intended, but that's a pivot around how we would provide internet. So that's going to require working with ISPs. That's going to require working with the companies that have that technology, bringing the cost down on that, and then working with the farmers themselves to realize that you need this technology, right? I mean, you could literally have every single cow, every single cattle connected to a device that says it has a temperature, right? Or it's not walking today, or things like that. And you know, that would put a lot less wear and tear on the cowboys or the bin riders or the people that are in charge of animal health. It would put a lot less wear and tear on the agronomist. Instead of having to go out on a four-wheeler and checking every field for temperature and moisture and leaf height and, you know, waxy cuticles and all that stuff, you could definitely do that in pros.
Is it just a gap in the food data collection then that agricultural farms and ranches were not as innovative on it?
Correct.
It's a program that's designed to connect
Homes.
residents to the internet, right? It's not necessarily, it does talk a little, but it's not necessarily, that was the primary purpose of
Yeah.
these grant programs.
Yeah, so that's why we're saying we're having to get more creative up here to kind of formulate some of our own solutions. I want to also bring it back to talk about the agricultural health. We're talking about people, right? So also education, and you know, we've got to remember that this is our rural communities are shrinking fast, and we talk about brain drain and all of that, and we do need to keep that in mind when we're talking about technology as well. So we want to make sure not just we care about the cows, we do very much so because they pay for our education, but
And they feed our people.
and they feed our people, yes. But there's a lot of things that are really important in the technology space as well with education. And we've got a lot of kids who leave their school in Spearman and go live in a rural area and don't have access to do their homework at night. So I think it's, you know, there's deeper problems with that too.
I guess the other point is how would you expect a farm to deploy digital technology if no one there has digital literacy, right? So, you know, let's just contrast it a little bit to New York or California that are at the forefront of precision agriculture. There they have community colleges, right? You don't have to go to a four-year university. They have community colleges that will teach you, just like Amarillo College, to work with a local seed company or with a local dairy solutions provider to work on these machines. And so if you go get a 6-month or 9-month certificate, you're already going to be making $75,000 to $90,000 working in the agricultural space. We don't have anything like that here, and we should, because the programs exist. So there's hospitals like George Washington University that have, they give blood pressure monitors to every single patient that comes into the clinic, every single one. And if you don't have a phone, they give you a phone, right? Phones don't cost that much, right?
What's that?
The company that we're working with. So it would be the same for agriculture, right? And, you know, if you want to go work at Western Equipment, John Deere dealer, right? They'll send you to school. They'll spend $100,000 sending you to Illinois and learning how to repair John Deere. We need more programs like that. And that's where the universities, the community colleges have to work with the industry. And one of the issues is that none of the big industry companies that do these programs are based here, right? They're based in Illinois, they're based in California, they're based in New York. So one of the things not to promote the range, but one of the things that we're trying to work on is get those companies to put these programs here. One of the first questions that they ask, by the way, is, well, we have all these digital tools, right? So we would like them to spend 6 months to 9 months getting proficient, and we're even willing to give them the Samsung Galaxies, the iPads, and like, sorry, dude, those high school kids don't have internet at their house or on a farm. One more example. When you go to try to fix a hay baler or hook up a plow or fix a fertilizer nozzle, there's no longer instruction manuals for that, right? It's too fast to keep up, right? But John Deere will say, just go to our YouTube page tutorial. In Hereford or in Cactus or whatever, you cannot go to the farm and look at the YouTube video on how to boot up or change anything. And I think if there's one thing that we could do that would be really transformative to this region, and it really has shuttled up our priority list, is if we could get internet to folks, we could get high-speed broadband, whatever it is. If we could get people on the internet, at least there would be some type of equity or parity between what's happening everywhere else along the country. Most of the other states, which are smaller, right, by the way, but have really put emphasis on putting high-speed internet, usually through mobile solutions, particularly to the places where there's orchards and farms. We have to do that here. And if we don't, our farmers are literally going to get left in the dust.
Well, that was a good one. You don't want to end it like that, do we? Do we have a joke?
I was gonna say, I'm just to be cognizant of time, but I'm sure that folks on the panel, if there are other questions, but I just want to thank you all for sharing some of the exciting things that are happening, some of the challenges and the pain points still, and I mean, you all spoke to it beautifully, what collaboration and partnership looks like, and that's how we've gotten this far. I think as connectivity continues to grow, it gets more connectivity, right? The more infrastructure that we can get, the more folks that get connected, and then the more often you're using the internet for all of these things, kind of it all can snowball from there. So really excited to hear about the opportunities, and thank y'all for all of your work.
Thank you all for being here, and I can want to end on a more optimistic note. We are making progress just by us all having this conversation, right? And having conversations with ISPs and with educators. Region 16 is doing tremendous work to try to connect our students. The hospitals are doing, Texas Tech really diving into telehealth. We're making strides, so I really want us to end what Maggie's doing with digital navigators and helping us really understand the needs. But I think it's really important for us to, I think we're missing the business needs. We'll put some emphasis on that too. But we're making progress as a community, and I'm really proud of that. I think just having these challenging conversations is step one. So thank you all for being here.
And before we all head
Oh,
out,
that's right.
I want to invite my colleague Heather Gata for just a quick announcement. So. Oh no.
Thank you. Thank you all for a great discussion. Really appreciate everybody's attendance, and this was a really great discussion, kind of coverage all the critical areas when it comes to connectivity as far as infrastructure and the application of infrastructure. As I always tell, as Molly said earlier, it's not about the nuts and bolts of the infrastructure, right? It's about people. It's always about people, how people can live where they want to live. It's not about changing people. It's about making the best, giving them the best opportunity to live where they want to live and achieve what they want to live. So we never aim to change people, but to give them opportunities to be competitive. So I get the honor of playing Santa Claus this week. I get to give stuff, right? I get to give stuff that's on topics. Connected Nation had the honor of partnering with Amazon on providing Eero routers and extenders that help to not only enhance connectivity in households, but it also helps with extension of networks, mesh networks. And so we thought, hey, you know, the range is doing some great work. So why don't we go ahead and make sure that we leave some stuff when we come here? And so we're gonna be donating 100 euros to the range and to Amarillo Area Foundation. It's, you know, as I was listening to him and the opportunities of making sure that these routers get to a few farmers who can, you know, leverage the ability to be connected, extend the signal to the barn and different interesting things that they can do. I think it's a great opportunity. And then we talked to the Amarillo Area Foundation. They're doing some interesting things with digital skills training, with connecting and empowering seniors. So this is an opportunity for them to have an extender in the household where they, often people have these spots where they're not getting the connectivity. Oh, on top of it, they can, providers don't be mad at me, but they can replace their router. If they're paying a little bit of a fee, they can replace with their own router. So that is their device that they own in the household and they can do that. So I'm very excited. We have partnered with a lot of nonprofits to get these to different communities across the country. And some of the interesting ones that we've partnered with, including some that are working with connecting smart homes for people with disabilities. So that's really essential for them to have a smart home because it gives them independence and the ability to do that. So, you know, in our 20+ year history, we partnered with everybody. If you want to partner with us to make the community better, we'll partner with you. So we're excited to this partnership with Amazon. And I do just want to welcome Carla Torres to come here from Amazon and join me so we can give this award to the range and to Area Foundation and to say thank you for being a partner to just sort of giving us the resources that help us to get a lot of people connected at least, you know, on our end.
Thank you, Heather, and thank you all so much for, like I was telling Dave earlier when we were talking before this event, I said, I'm here to be a fly on the wall, learn from the community. And he said, don't say fly on the wall because people kill flies. And I said, oh, you're right. I am here to be a butterfly on the wall. I lead our devices and services community engagement team at Amazon. And so, you know, we've done a lot of work helping to use technology for good. I launched for example, a national program that supports domestic violence survivors with great technology because it's one of the most requested pieces of technology to keep folks safe. And similarly with Eero, and as we have new technologies coming out in low Earth orbit with Kuiper, I'm just here to learn. What are the challenges? What are the cool stuff? What's the innovation that's happening here in the Panhandle and other rural communities? And then, you know, be able to better use technology for good. So we're proud to be able to provide these Eero mesh technologies to both the range and the Amarillo Area Foundation. So excited that you all get to use it, and hopefully we get some cool use cases out of it too. And I get to learn more about how they're being equipped here in this area. So thank you. Thank you so much. Thank you, Heather. Thank you, Carla. Thank you all. I appreciate you all so much. We'll stick around for questions if you want to. Oh, and if it comes, we'll be doing a bit of follow-ups. And thank you so much, Molly. We appreciate the information and you're putting up with us over here. Thank you all so much for being here.